let's go into your administrative team, but
Sure.
first tell us a little bit about your history and what attracted you to this area.
Well, I've been in healthcare management and administration for over 25 years. Have always been in rural healthcare communities in North Carolina, Western North Carolina, Tennessee, and then back in the Triangle area. And so I've spent my entire career in small to mid-sized communities and working with medical staffs and boards and organizations and helping them grow and see and fulfill their potential for what they can do and mean for their community.
And
so
I hear you got a grassroots start in healthcare. You were an
did.
EMT,
I
right?
was a paramedic before spending some time with the military, and I spent and then came back and spent some more time as a paramedic, and actually went up to the mountains of North Carolina to help a hospital bring in an EMS system. After being able to bring that EMS system in and spend a couple of years, the CEO was the individual who had hired me, asked me to come over to administration. And so I thought, well, didn't know exactly what that meant, but I thought, sure, we'll do that. So,
and you've always lived in the communities that you served, right?
Yeah, I believe very strongly. So my first job in EMS, we did not live, we lived adjacent to the community, and I realized then that you really needed to live in the community to understand it. And that's even more important and powerful in healthcare, and if you're delivering that healthcare and working with physicians and the sense of community and communication that needs to occur, it's hard to achieve if you're not immersed in the community and understand how the community works, talks, and plays together.
Right, and that type of interplay is important, particularly when you run a very complicated business as a hospital. And in operating a very complicated business as a hospital, I look at that as a captain of a battleship, or more like an aircraft carrier, something that's huge, that has the requirement of thousands of people to become operational, that has a vision, that has a goal, and that has to protect a lot of people. And then it's very expensive to operate. And can be in trouble if you don't do a good job. To do that, to exercise that vision, you really have to have an amazing team. And part of what you were hired for was that vision.